Good afternoon. So I will be doing parenteral medication administration, which is intradermal, subcutaneous, and intramuscular. So I will start off with doing performing eye checks, which is introducing myself, um, asking patient their name and date of birth, checking their armband, performing hand hygiene, explaining the procedure, check order, and provide privacy. I'm gonna verbalize 6 medication rights, which is right patient, right medication, right dose, right route, right time, and right documentation. I'm gonna perform pre-medication assessment, which is doing lab result, which is checking the lab results, vital signs, and any allergies that patient may have. I'm gonna educate the patient what the injections are for, and what their potential side effects can be. So I will start off with doing intradermal, which is the TB test. um, I'm gonna retrieve the medication, check against MAR, making sure I'm getting the right medication, the right vial. So I'm gonna start off with cleaning the vial, or I'm just gonna do this, cleaning the vial with the alcohol wipe. Let it dry, and I'm gonna select the correct needle and syringe for the TB testing or intradermal injection. It is 25 to 27 gauze, and I'm gonna draw 0.1 ml. So I'm gonna draw the air into the syringe, um, which is 0.1 ml, and then I'm gonna insert it into the vial and push the air inside the vial and invert the vial and withdraw the correct dose. I'm gonna remove the syringe. I'm gonna expel any air by tapping the syringe and pushing the plunger up until the desired dose is reached. I'm again gonna do my 3 MAR check, which is while preparing the medication, the second one, against the MAR, making sure I have the correct medication. And I'm gonna prepare the patient's side, which is inner elbow. I'm gonna clean the site with the alcohol wipe. Wait until it is dry. Wait until it is dry. So it is the inner forearm, yeah. And when it's dry and before injecting, I'm gonna make sure the bevel is up, and I'm gonna insert the needle to 5 to 15 degree angle and administer the medication, forming a bubble. I'm gonna remove the syringe or needle, or I'm gonna remove the needle. I'm not gonna recap the syringe or needle. I'm gonna apply the safety shield if it's available on the syringe, and put it in the sharp container. I'm gonna remove my gloves and perform hand hygiene, and do some teaching, like not to rub the area, not to apply the bandage, and come back for the reading within 48 to 72 hours. And then I'm gonna document the procedure that I did. Okay, so I will now do subcutaneous, which is heparin, epinephrine for emergency, and insulin. So again, I will perform my eye check, do my 6 medication rights, perform pre-medication assessment, and educate patient. And when I prepare the medicine, I do check the patient's blood sugar, ensure that they have a food tray in front of them before administering the medication. So I will start off with retrieving the medication, clean the vial, top of the vial with the alcohol wipe, and wait until it is dry, and getting the correct syringe, insulin syringe. They are usually in units. So when drawing up the medication for NPH and regular one, it is usually cloudy to clear and clear to cloudy, which is I will draw the air. I will draw the air into the syringe equal to the medication dose and inject it into the NPH first and then to the regular. Without removing the needle from the regular, invert the vial and drawing the medication from the regular vial, the correct dose, and then remove the needle and insert the needle to the NPH and get the medication I need without returning any medication. So I have to make sure that I get the correct dose from the NPH, and I remove the needle from the NPH vial. I confirm the correct dose with the second nurse. Then I do my 3 MAR checks, which is when retrieving the medication, while preparing the medication, and before I give it to the patient. Next, I'm gonna do select the site, which is gonna be abdomen. It could be around the umbilicus. I'm just gonna make sure it is 2 inches away from the umbilicus. I'm gonna clean the site with the alcohol wipe, let it dry. Pinch the skin, insert the needle from a 45 to 90 degrees angle, 45 to 90 degrees angle, and administer the medication. Hold for a few seconds to make sure the medication is delivered properly. I'm gonna remove the needle. I'm gonna make sure that I do not recap the needle, and I'm gonna apply the safety shield if it's available and put it in the sharp container. I'm gonna remove my gloves, perform hand hygiene, and document the procedure. Okay, so the next I would do intramuscular injection. I will start off with performing the eye check, doing the pre-medication assessment, doing my 6 medication rights, educating the patient, perform hand hygiene, putting on gloves, starting off retrieving the medication, starting off with cleaning the top of the vial with the alcohol wipe, let it dry. I'm gonna make sure I get the correct needle and syringe, which is 23 to 25 gauze. I'm gonna draw the air into the syringe equal to the medication dose, and inject it into the vial. Invert the vial, get the correct dose, and I'm gonna remove the needle. I'm gonna tap the syringe to remove any air bubble inside the syringe, and I'm gonna push the plunger up until the correct dose or desired dose is reached. I'm gonna do my 3 MAR checks, which is when retrieving the medication, while preparing the medicine, and before giving it to the patient. I'm gonna choose the site and clean the site with the alcohol wipe, which is gonna be the deltoid muscle. So I will clean the site, I will let it dry, and I'm gonna hold the muscle, let it make sure it's not tensed, the muscle is relaxed. I'm gonna hold the muscle, ensure the position proper, the patient's position is proper, and the muscle is not tensed. Yeah, and I'm gonna insert the needle to 90 degrees, administer the medication, remove the needle, and apply gentle pressure to the side. And I'm gonna make sure I do not recap the needle, and apply any safety shield if it's on, and put it in the sharp container, remove my gloves, and perform hand hygiene and document the procedure.